Greetings, ladies and gentlemen. I'm Joseph Atik, Executive Chairman of ID for Africa. I'd like to welcome you to the final session of the ID for Africa Marathon, which has been going on for the last 3 days. It's definitely been a marathon. It's been intense. It's been very interesting. I've been listening to all the presentations and what's been going on. I hope you found them very interesting to you and also pertinent to your objectives, whether you are from the African governments or from the private sector or from the development agencies. What we try to do is try to give you an overview of some of the innovations that are now available. If I had to sum up the meetings or the marathon in a few words, I would say we saw a lot of diversity and choice. So in a way, it indicates that the marketplace is a healthy marketplace, not dominated by one or two players, but in fact, as end users, the customers will find choice. They will find plenty of vendors that can provide them similar technologies or alternative solutions that will achieve the same. And that's the great objective, to allow you to have choice. So that came loud and clear throughout these 3 days. I hope you felt that and you saw that as well. So what we're going to do now, we're going to run the fishbowl. The fishbowl is a session that we usually do in the annual general meeting, the physical ones, which sums up some of the discussions that we've had. But more importantly, it gives you, as the audience, the opportunity to step up to the panel and be the panelists. There are no panelists, but you are the ones who are going to be on the panel. We've waited a little bit because there was a confusion about the link to get on the Whova, from the Whova to the Zoom platform. I hope that has been straightened out and that those who are planning to attend have made it here. But in any case, we will be going on for a couple of hours and we will be warming up and bringing in people to the panel. So please, if you have something to say, please raise your hand when I ask you to do so, or even at any moment in time, raise your hand and an operator will reach out to you, prepare you to bring you to the panel. So use that as the main platform. You can ask questions, but at the end of the day, really, we want to hear you. We want to hear your voices. We want to hear you participating live on the panel. However, before we start the fishbowl, I've asked Dave Gerulski from Integrated Biometrics, which is our platinum sponsor, one of our platinum sponsors for this event. I asked him to give us a speech or a presentation that I'm hoping would be a fire starter, something that could be striking, controversial, something that would promote a discussion related to where we are today in the aftermath of the COVID pandemic and what the choices that are available for technologies for identification. So without any further delay, we'll ask Dave to come on board. He will give his speech. I'll get off and then I'll come back and we will kick off the fishbowl with a small poll asking you to propose topics and then vote on them so that we can address them in the highest order, in the order of your choice. Okay, so operator, could you please bring in our first element of the day, which is a fire starter speech from IB, Integrated Biometrics.
Ready? Hi there. Today we have Unmistakable Identity, Irrefutable Results. Why fingerprint biometrics remain the ultimate choice. Good day, delegates, partners, and friends. And a bright and cheerful good day to you, Dr. Atik. Thank you so much for inviting me to speak to this distinguished audience as we prepare to complete the first virtual ID for Africa Summit. I am David Gerulski, Executive Vice President of Integrated Biometrics. This is my fourth ID for Africa, and I've enjoyed them all, both in person and virtual. Who would have thought that part of this year's ID for Africa would be coming to you from Atlanta, Georgia, here in the United States? You probably know Integrated Biometrics as IB, or you might recognize us by our products, which are all named after fictional TV detectives: Kojak, Watson, Sherlock, Columbo, Dano, and 5 others. It's also likely that you know IB because you've used one of our fingerprint sensors. There are tens of thousands of our sensors operating in countries throughout the African continent, helping to protect your borders, securing your vote, and managing your health needs. Our innovations delivered into Africa are the same safe, rugged, innovative solutions that provide unmistakable identity around the world. There's that word, unmistakable. When you consider identity, the word unmistakable is essential to the conversation. You don't want good enough. Is a 90% match good enough? How about 95%? 99% seems pretty good, doesn't it? But what if it's your child being matched in a healthcare database? Maybe he or she is allergic to a certain vaccine. Is a 99% match good enough then? Or how about when a known terrorist boards a plane? How do you feel about 99% accuracy in that case? That's why the word unmistakable must be the bar we set. Now today I'm going to address three key elements of fingerprint biometrics and why they remain the ultimate choice for delivering the vision Dr. Atik and the ID for Africa movement have started. Those three elements are reliability, availability, and affordability. In addition, I'll address my favorite topic, innovation. Now, I was recently asked if COVID-19 would be the death of tactile fingerprint sensors. Tactile meaning fingerprint sensors that you touch. Well, maybe for some vendors. But if your solution provider, like IB, is a technology innovator, then the answer is an absolute no. Tactile fingerprint sensors are the most reliable, most available, most affordable solution for biometric identity projects, and innovation is making them safer as well. So let's start with reliability. Fingerprint biometrics are as unique as the individual. This has been proven over the last 130 years. The first modern classification of fingerprints based on minutiae was developed by Sir Francis Galton in 1892. Galton used latent fingerprints to distinctly identify individuals. His system, and later that of Sir Edward Henry, are responsible for the classification of billions of images. This is one of the reasons why tactile fingerprints remain the #1 biometric resource in the world. And best of all, for more than 40 years, fingerprint collection has been based on the same FBI certification standard, capturing 8 fingers, 2 thumbs pressed against a flat surface, and now uploaded to an APHIS database where electronic matchers ensure a unique pairing. What's common among the FBI certified fingerprints? Each one is captured while pressed against a flat surface. The image is stored at a resolution of 500 ppi and consistent with 256 grayscale levels. There are other biometric innovations available in the market, many which have been discussed this week. But why these solutions are touted as fast and easy, are they accurate enough? Consider the case of Robert Williams in the US, a young Black man wrongfully accused by an algorithm, where a faulty facial recognition match led to his arrest for a crime he did not commit. Police arrived at Robert's home and arrested him in front of his wife, his children, and his neighbors. They handcuffed him and hauled him off in a cruiser. The algorithm was confident it was Robert's face in that video. But we all know how well that worked out. So ask yourself this: if you were Robert, would fast and easy be an acceptable criteria? That's why it's important that fingerprints are largely unbiased. And at IB, we take that even one step further. To us, every fingerprint is blue, even before converting to grayscale. There is no identifiable pigment in an LES image. Neither race nor ethnicity is part of the equation. And what about privacy? With fingerprints, you decide where you want to be identified, which is not the case with other biometric solutions. The use of facial recognition in a public forum takes away your right to privacy. By simply walking down the street With a strategically placed camera, you unknowingly expose your identity to anyone with access. Now, let me be clear. These and other forms of biometric identification have their place, specifically in verifying the identity of an individual in a multimodal solution. However, for enrollment in large data sets, tactile fingerprints remain the most secure, the most reliable avenue to identification. Now let's address availability. Electronic tactile fingerprint sensors have been on the market for 40 plus years. Addressing specifically the FBI certified market, a variety of biometric providers and products have come and gone. Yet, as stated earlier, because the fingerprint market is standards-based, changing vendors or hardware devices over time has always been relatively easy to do. For example, the market went from 10 print scanners as big as a shoebox to devices like this that can fit into your shirt pocket. And not only did the size of the devices change, but they also became smarter, faster, more durable, and now safer. To the government and commercial procurement attendees, I offer another reason why working with solutions based on standards such as the FBI Appendix F certification for enrollment is advisable. There are dozens of fingerprint sensor providers with compliant solutions, which means no single vendor can hold you hostage. What does this mean? It means that if for some reason you're not satisfied with your fingerprint biometric provider, then pick another one. Your database has been filled with fingerprints that meet a global standard. You have a choice of fingerprint sensors, fingerprint collection devices, fingerprint matching solutions, and APHIS databases because they are all standards-based. Interoperability is key. Don't let yourself get vendor locked by an overall solution that is only available from one company. Make sure your data is portable, readable, and matchable by other vendors. Okay, so finally we come to affordability. Because of their widespread availability, tactile fingerprint solutions are affordable and available in all sizes and configurations. Many organizations already have an APHIS database filled with biometric data based on fingerprints. Imagine the extra costs in manpower to acquire new biometric modalities, let alone the new equipment needs. In recent years, fingerprint biometric enrollment, verification, and identification have become truly mobile, thanks to innovative vendors who have built devices that can enroll 10 prints in a handheld solution, are rugged enough to toss into a backpack for travel, and require so little electricity that they can run for hours without recharging. Enrollment systems today no longer require a pickup truck and a trunk. 10 print devices are available in small cases and in tablets. And what's most amazing is that the entire solution, including tablet, printer, and camera, costs less than the standard desktop device from just 5 years ago. By taking the sensor to the customer, acquisition costs have dropped dramatically. Now, tactile sensors are making Dr. Atik's dream of identity for all a reality, because innovators like IB and our partners have created field-ready devices that are accurate, reliable, and affordable. So now that we've addressed those three areas, let's move on to my favorite topic, innovation. Tactile fingerprint systems today are mobile, more secure, more accurate, faster, and safer than ever before. Let's look at some highlights. More than 10 years ago, IB introduced light emitting sensor technology, also known as LES. LES uses extremely low levels of electricity and electroluminescent particles suspended in a film to produce a high-resolution image. When a finger touches both the platen and the bezel, it acts as a conductor and generates the fingerprint on the bottom of the film. Let me say that again. LES uses extremely low levels of electricity and electroluminescent particles suspended in a film to produce a fingerprint image. I repeated this because the inherent design of LES sensors that many integrators are incorporating in their devices today, such as BioRugged, Kopernik, Technocrat IT, Laxton, and Credence ID, along with many others, have a distinct safety advantage over all other non-LES technologies. But I'll get to that in a few minutes. LES removed the need for heavy, fragile glass prisms and glass platinums. Power consumption is dramatically reduced due to the absence of the light required for illumination. Fingerprint acquisition no longer requires a darkened room and can be completed in the field under direct sunlight. The development of thin film transistor technology, also known as a TFT, has dramatically reduced the size of fingerprint sensors. Multiple vendors today offer TFT sensors as a solution. New advances in encryption technology allow information exchange between sensors and hosts to be securable, which prevents man-in-the-middle theft of the data. This technology is important in scenarios such as election kiosks and other unattended venues. To prevent fake finger enrollment or identification, presentation attack detection software, also known as PAD or anti-spoofing, is an advanced technology which uses mathematical algorithms to determine if an image is real or fake. With LES, PAD software is supplemented by hardware-based fake finger rejection. Government and commercial entities alike are making huge investments in biometrics. To protect these investments, locking software is now available to prevent your fingerprint sensor from operation with an unauthorized host, ensuring your sensors are not being borrowed or outright stolen and used as a collection device by another entity. Advances in software algorithms are replacing expensive silicon pads to capture hard-to-collect prints from dry fingers, often associated with older subjects and where fingerprint enrollment and verification are maintained in very dry or arid environments, or in unfavorable conditions, such as immediately after debarking from a plane. Each of these innovations on their own are impressive, but let's address the most important topic of the day, safety. Now, I've hinted throughout this presentation that touching a fingerprint sensor is safer today than ever before. The pandemic has increased awareness of transferring diseases by contact with public objects. When considering identification at borders or during elections, hundreds of individuals can contact the same device over and over again, with little or no cleaning between touches. And though both the CDC and the biometric industry recommend washing or sanitizing your hands after touching such devices, there's no way to guarantee that will happen. So nothing would be better than for the device itself to have the ability to eradicate bacteria and viruses on its own. Let me introduce you to two new, very different solutions that address two very different microbial threats. The first is a new antibacterial coating that has been used in hospitals and is now being applied to the fingerprint sensors to prevent the growth of bacteria. Even though these are effective at killing dangerous bacteria such as E. coli, they will not kill COVID-19. So what can kill COVID-19 and possibly future viruses? Well, in 2020 alone, billions of dollars were spent globally researching technologies to kill the COVID virus. And one of the proven solutions is the use of extremely low electrical fields that produce charged particles, which in mere seconds literally pull the cell structure of the virus apart. In May of this year, scientists at the University of Indiana's Department of Infectious Diseases discovered that an electrically charged face mask killed COVID-19 virus on contact. So after learning about that breakthrough, IB's chief scientist, Fred Fry, began working with scientists at the University of Missouri's Infectious Disease Center to prove that IB's LES fingerprint sensor could have the same effect. His theory is that because an electrical field is present on the platinum bezel, it too could actively kill COVID-19. Now, While the research report is not yet complete, I can say with confidence that the technology to actively kill the virus, where your hand makes contact with the sensor, is sound. And IB will make an announcement as soon as the official report is out. Just think about this for a minute. If our theory is correct, then the safest thing you can touch in public would be an LES fingerprint sensor. Ironic, isn't it? And if that news isn't exciting enough, consider this. We're not talking about having to develop a new device. If you already have purchased LES sensors like NIBS in Nigeria and the electoral committees in Ghana and Zambia and applications throughout Africa, you already have everything you need because all LES devices inherently have the COVID killing capability. With that, let's do a quick review. I've talked about 3 specific benefits of tactile fingerprint sensors: reliability, availability, and affordability. I then addressed new fingerprint innovations that make these 3 benefits even more compelling, including presentation attack detection, encryption, and locking technology, and safer devices through antibacterial coatings, and most importantly, active antivirus technology. And there it is, unmistakable identity, irrefutable results. That's why fingerprint biometrics remain the ultimate choice. Or as I like to say, unmistakable ID, unmistakably IB. Thank you, Doctor.
Thank you so much for this presentation, Dave. We should take any questions for Dave in this regard. So, anybody would like to step up to the plate? What Dave is basically saying is that, correct me if I'm wrong, Dave, fingerprints can be implemented in a safe manner to maintain the same level of standard that we've all been accustomed to, which is that fingerprints have delivered for all ID programs in the past. So somebody has raised their hand. I'd like to bring them to the panel, raise the question and discuss with Dave and engage. Paul, could you elevate Paul to the panel, please?
Thank you so much, Dr. Atik. It's good to see you again.
Where are you coming from?
I'm from Nairobi, Kenya.
So today you're coming from Nairobi, Kenya. How is the weather there?
Well, it's a bit cold, but not so bad, manageable. I mean, the fever of the year ending is what is keeping us warm.
I see. And the COVID, any developments? Are you guys beyond that or not?
Not really. I mean, in the last few weeks, the positivity rate has been quite high, slightly above 10. But we are hoping for the best. There's a lot of public awareness on the importance of observing the COVID-19 regulations.
Restrictions, yes. Mm-hmm.
Yeah, and we are trying.
I see your son is also trying as well.
Yeah.
Anyway, Paul, do you have a question or comment for David?
Yes, I have a question related to Dave's presentation. That was a great presentation around fingerprint-based biometrics. But I think the biggest challenge will be user perception, especially probably in a healthcare setting, because people have been accustomed to believe that COVID-19 is all about touching infected surfaces. So like in a healthcare setting, using biometrics or fingerprint biometrics for identification will still be a big challenge because of fear of the unknown and just perception and thinking. Well, what's your suggestion, Dave, on how best this could be addressed?
Well, thank you for the question. That's a great question. And it's true, you know, education is the #1 topic on getting people to understand what is safe and what isn't. And this is going to be a project, not just based by, provided by IB, but it's going to be IB, our partners, and actually the government agencies and other organizations that are implementing these types of technology. Together, we are all going to have to work so that we can help educate the public so that they can feel more comfortable about going back and touching a fingerprint sensor again.
That's a good point. And I also think maybe some acceptability and feasibility test around the technology would be great. And definitely, I'd be willing to work on you on such an idea in Nairobi, Kenya.
I mean, Paul, does the context where you're working, which is in the healthcare, what kind of biometrics are you guys using today? If you're not using fingerprints, even before COVID, what do you use?
Fingerprints was the thing, but there have been a few pilot projects around iris with unique challenges, definitely.
Okay, so fingerprints have been, and I know that you have done a lot of research on the use of fingerprints for infants, for young children and infants. Maybe a question we can take to Dave. Dave, Paul's research had indicated that high-resolution sensors could help create a platform for fingerprint capture of infants and children. Is that the direction that the innovative folks at Integrated Biometrics have been exploring, or you're focused simply on delivering to the adult fingerprint community?
Dr. Atik, great question. Actually, Integrated Biometrics has a white paper already based on this topic. Mm-hmm. And not only do we have a white paper, but we have an excellent little sensor called Dano that is really great for capturing small children's fingers. It's small, it's easy to get the finger around, very high resolution. And we would love to work with Paul and provide him with some samples and let him do the testing on his own. We found that newborns are still a little tough to capture. Their fingers are very, very wet, and the ridges are not very strong. They're very malleable. But we've discovered that within just a few months, picking up a child's fingerprint image is very easy to do on our devices. So we'd be happy to work with Paul or other organizations that want to test. And I'd be happy to provide some free sensors to them to work with.
That sounds like a great idea. One of the unique challenges we faced with our studies in infants is the desire for an integrated device. Because one point of failure, because we set this up with healthcare providers who are non-techies, connecting and setting up was one of the weak points of the system. So are you thinking about an integrated, probably Android-based device for this setup for the infant biometrics?
Yes. In fact, you can do it as simply as attaching a Android phone directly to the Dano device. But we have some great partners that, we build sensors. That's our expertise, and that's what we work on in the world. We have great partners that build actual devices and applications, including the matching, the middleware, the databases. And we can certainly hook you up with somebody like that who already is really thinking about the total solution to solve this problem.
Thank you so much. That's a great opportunity to look forward to.
Thank you, Paul. I hope we can arrange for a collaboration between you and the innovative folks at Integrated Biometrics. Thank you, Paul.
Thank you so much, Dr. Atik.
We have another question, Dave. Just to emphasize, join the conversation. If you have a question for Dave and you want to join the discussion about contactless versus contact biometrics and how fingerprints could continue to be an important element of your programs, come on the panel. We would love to hear from you. The question from Melissa. Melissa, are you available on video? We can promote you to the community so we can hear what you mean by this question. Otherwise, I'll ask it to Dave. So Melissa, if you're there, please raise your hand so we can promote you. In the meantime, Paul, thank you very much. And I'll mention the question to Dave in reading. Hopefully Melissa will be will be joining us. Otherwise, Dave, you can answer that question. Melissa was asking, can you mention the virus killing capacity again on the devices? They seem to be intrigued by that. I was intrigued by that as well. When will the research be available and published? Thank you.
Okay, so this is the interesting part about this new discovery. I would recommend any of you go out and Google the killing COVID with electricity and face masks. There's some great research out there from the University of Indiana that is what spiked our interest in this technology. And so, as I mentioned, it's by the way that we natively produce a fingerprint image. IB's uses a different technology than nearly every other technology out there. We actually use this film, and the film has electroluminescent particles in it. And when you put your finger on one of our devices, it has very low, very safe, you can't even feel it, electrical charge going through the bezel and the platen. And when you put your finger on it, you actually conduct an electrical field that creates the image. And as I said in my presentation, the beauty of this is if you're already using an LES technology sensor, it's already doing this for you. Now, what IB is working on at this point is we're working with the University of Missouri to get the official report that is written that states, like the mask in Indiana, that the electrical part of IB will actually kill the virus. Viruses have a cell wall, and it has ions in it, and when they're put around electrical charges, they actually pull the cell apart. Kind of like when you have two magnets. And some magnets you pull together and other ones are separated apart. That's what is happening with our technology. So you don't have to wait for our products to come out in 6 months or a year to do this. They are already doing this in the field today.
Excellent. I think we've got Melissa with us finally. Melissa, hi. Could you please introduce yourself? Who do you work with? Where are you based? And where did the question come from? Where is your interest?
Wonderful. Well, thank you so much for having me. This has been a tremendous week, and I'm just so grateful to be a part of it. My name is Melissa Stalick-Burke. I work for AID. We're based in Malta and also affiliated with Trustamp. And right now I'm currently in the US participating, and it's been a great week. So the reason why I was asking this question is because I've just been tracking COVID significantly and really been paying attention to all of the presenters' research around how they're trying to mitigate this as they go into the field and use their technology. So I just wanted to know more about how this was being developed and some of the new ways that it could be implemented. And again, that research, that was very helpful, David, to know where to look for it. And I've just been trying to track it and understand best practices. So I'm looking forward to it being published soon. So thank you.
Great, thank you very much. And
excellent.
You know, one of the things that people have said to us after they've learned this is they said, "Hey, wait a minute, can we put your film on the bathroom door?" I don't think we're there yet, but there are other places that this type of technology could have real benefits in the near future.
Well, thank you so much, and thanks for having us be an exhibitor at the event this year.
Thank you, Melissa. Thank you for being here. Okay, before I say goodbye to Dave, I'll remind you, we're going to continue the discussion, but broader. We're going to broaden to talk about any topic that you think is pertinent on your mind. Of course, if I don't see any topics pertinent on your mind, I'll start putting topics pertinent on my mind. So, but before I move into that, I want to give a personal testimony. Dave, as you know, I've known about your technology, maybe now 8 years. I can't remember going back how long it was, but when I first saw your technology, I said this was a game changer. And what I saw in it was not, we were not in the era of COVID. We were in the era of inclusion. We were desperate to basically change the game by creating devices that would allow us to capture the fingerprints of the missing billion. I mean, giving a device in the field, something that has the low power consumption and has the ability to have a form factor. It's not like in the days when you have huge devices. So personally, I was a witness to this. Of course, I have no commercial interest in IB or anything. This is not an endorsement. It's just a personal testimony, is that when I see an exciting innovation that comes along, I like to share it. And I can say that as a result, for example, Mexico managed to develop its identity ecosystem for banking as a result of this breakthrough. And now I'm seeing a lot of places in Africa. How is IB's penetration in Africa going right now? Could you just close up by saying, where are you in Africa and how do you see Africa being part of your future?
Well, we are quite well spread out across Africa. We were involved in the Guinea elections this year, the Ghana elections, the Zambia elections. We have, we've actually, put our technologies in some really great places. We've been working with an AIDS organization in South Africa to be able to do identification without actually giving away names and such. But and some other really interesting applications for human rights. So we're all over. There are some very large opportunities that we're working on today. 2020, though it's been a COVID year for all of us, we've had good results this year. We expect much bigger next year in 2021. As I always like to say, our goal is to build the best sensors. Not only are we doing these things for health, but we're also thinking about our actual partners or the end users who need locking devices and great fake finger devices. We're doing innovations. IB wants to be the innovation company. And then we leave it to great partners all throughout Africa, both local on the ground in Africa and other organizations that are coming in from other countries or continents who are working there to make the best applications. And we're really proud. We're really excited to be the innovator that these people are working with to base their devices on.
Excellent, Dave. Really, thank you so much. I see a raised hand. Operator, could you please elevate Greg Boat to the panel? Greg, can you hear me? I think if Zoom is listening to us, they need to speed up the up and down. Hey, Greg.
Hi, I think I'm on now. I wasn't sure if I was on there.
Yes.
Yeah, I've listened to all the sessions over the last 3 days, and I've just got a point to make that I've heard so many presentations by solutions providers around mobile identity and digital identity via mobile. It's not surprising because with COVID, the idea of people identifying themselves remotely has become more and more important. So a lot of mobile identity presentations and discussions, a lot of digital identity, but that's over smartphones, and a lot of onboarding presentations, but again, those were all over smartphones. And I'm just wondering, I'm interested what people think about the fact that they're all related to smartphones, because I know more and more people are using smartphones in Africa today, but still, as far as I'm aware, by no means the majority. And I don't know how long it will be before the majority of people in Africa are using smartphones. So still a lot of people using ordinary feature phones. And so I'm just wondering, where this is going to go in Africa if you need more digital identity and onboarding and everybody's using feature phones. Yeah.
This is a good thread for us to take on, but let me direct it back at Dave. Dave, what Greg is pointing out is that the future is going into the mobile phones, and the mobile phones are not yet able to use integrated biometrics as platforms Can we expect that one day will come that mobile phones will have integrated biometrics as a platform, maybe even in the glass itself? I mean, where are you in that regard?
So a couple different things there. The one key I want to make is that remember that we promote enrollment with an actual FBI certified fingerprint sensor. So that's the first part. You know, being able to use mobile phones for either touchless applications or touch applications is great for verification or identification. They're still not right for the actual enrollment. So enrollment needs to be done somewhere. IB actually has devices. Then the next thing that happens is that most fingerprint scanners on any type of a phone are not good enough for really large databases. So, you know, there's applications that are based already, and it's hard for you to see, but where you can actually take an IB FAP30 device and attach it directly to the phone. So that's another way. But, you know, it's the providers out there, our partners, who are building these tablets that are just wonderful for taking and acquiring fingerprints for enrollment. And so, yes, there are solutions coming for mobile phones. IB itself has a touchless application that is available for recording your own fingerprints. But we still believe, and I think most of the market believes and understands, that you need an FBI certified fingerprint scanner for enrollment purposes.
Enrollment. Okay. David, thank you so much. I'm going to release you. Once again, thank you for being part of the ID for Africa movement from the beginning, and thank you for continuing to be with us going forward. We hope we will see you in a physical context in 2021, and there will be more wonderful news to share.
Can't wait to see you in Morocco. Thank you.
Thank you. Thank you so much.